Thank you everyone for joining today's session focused on supply chain and where we're at with regard to 2026 and the challenges we're facing and some of the key aspects that can be considered as we move forward in trying to address those key challenges. With that, we want to do a quick introduction to both myself and Carolyn Howard. I'll go ahead and get started. My name is Paul Weitraub. I've been doing consulting for the last 25 plus years in the healthcare realm, covering the broad basis of really just trying to drive operational and financial improvement. Currently, I lead Coker's integrated solutions or performance transformation practice and cover all aspects of revenue enhancement or cost out with regard to healthcare systems. Carolyn?
Hi, everyone. My name's Carolyn Howard, and I'm lucky enough to work with Paul at Coker, and I lead our supply chain and purchase services area. I've been working in the healthcare industry for over 35 years. 30 of it has been specifically within supply chain. I've worked in everything from operational improvement, doing inventory, distribution, all of those types of things, organizational redevelopment. And then a lot of it, of course, has also been in margin improvement. And I'm very excited to be speaking with all of you today. Thank you.
Great. Thanks, Carolyn. Appreciate that. All right. Right before we jump into our core material, we did want to give you just a perspective on who Coker is for those who are not as familiar. Coker's been around quite a long time, about over 35 years, focused on initially the ambulatory space, but over time has grown into a full-fledged consultative offering specifically within the healthcare sector. We cover the basis as far as everything from safety net hospitals to some of your largest acute hospitals in the country. We have resources also spread across the nation and are focused on everything from strategic planning and strategy to performance transformation, again, driving revenue up, cost out, as well as transactional advisory. So covering your basis around both on the buyer side and sales side of things, and all things compliance from a compliance services standpoint. So we do cover a broad brush of support for healthcare providers and non-acute settings. We really do bring a trusted expertise from the standpoint of bringing individuals who've been there, done that, and are focused on the implementation of improvement, not just the strategy, but actually integrating the strategy with the actual execution and delivery of improvement on both the bottom and top line. And we really focus ourselves on being client-centric. So whether that means taking a pilot, co-pilot perspective as far as taking a back seat in order to transition appropriately to your leadership, or we also can lead things and drive it to success as well. So that's just a little bit about ourselves. And now we want to get started on our material for today. So we have three key topics. One is understanding the supply chain environment today as of 2026. Number two is to focus on what healthcare systems can do to manage what is controllable. And we'll talk a little bit about what is controllable and what is not, and what comes next. So what should you be thinking about going into the rest of 2026 and forward? So with that, I'm going to hand it off to Carolyn.
All right. So let's talk a little bit about supply chain and what is the environment today. So why should we even be concerned about supply chain? That's really what this slide is all about. When you think about the costs that are involved with supply chain, it's beyond the medical, surgical, and pharma supplies. So when you think about medical, surgical, and pharma, that's about 11 to 22%. But when you add in the purchase services, food, contract labor, and IT, that really adds up to about 48% of your costs. And then if you add in the hospital and medical equipment, that can be as much as 50% of your costs. So that's really why we want to concentrate on supply chain in its totality, because that includes all of the purchase services, capital, equipment, et cetera. The other thing about supply chain is when we drive cost out of the system when it comes to supplies, capital, purchase services, those savings pretty much translate dollar for dollar to the bottom line. So when we sign those contracts and we drive those savings, go straight to the bottom line. The other thing we really wanted to focus on is thinking about what's happening around us in the world and within the nation that's impacting our supply chain. So when you think about what's happened within the last year that's impacting us today in 2026, you have the impact of the Affordable Care Act that was dismantled in December of 2025. You have the impact of the Rural Health Transformation Program. All of those patients eventually are going to hit our acute care centers as much more chronic patients than we've had in the past. There was a lot of loss of coverage. We do have the impact of additional monies going back into those rural communities. We don't necessarily know how that's going to go back into those rural communities and how they're going to use those dollars yet. We have care migration into non-acute settings. So that means our supply chains are going to have to expand in order to accommodate those non-acute settings and grow past those boundaries that they've been in the past. The growth of ambulatory services, the cybersecurity threats, just as we've seen at the beginning of this year with Stryker and others, those continue to be an issue and will continue to be an issue into the future. And as you'll see on upcoming slides, we in supply chain have a lot of external touches into the cyber community that we have to be aware of and that we are impacted by. There's a focus on back to basics, so making sure that our operations, our inventory management, our clinical throughput, block scheduling, preference cards, all of those are operating the way they should be. We're continuing to be impacted by the global economy. A lot of our raw materials, pharmaceuticals, med devices come from overseas, so we're going to be impacted by global disruption. There's a huge impact on AI and how we're going to utilize it in the future. It's not going to go away, and it shouldn't go away. It's going to help us, but we have to know how to do that. And there's a lot of mergers and acquisitions going on that we have to be aware of, and a lot of them are with distressed organizations. So what are the top supply chain challenges for 2026 that we should be aware of that when it comes to supply chains? The first is tariff-driven cost shocks are still out there. So we still get bounced around when it comes to variability and volatility when it comes to tariffs. And we have to be aware of that. And we need to be aware of it when it comes to contractual language that gets embedded into contracts and supplier contracts that we need to read through and understand how that's going to impact our overall cost. Persistent inflation in purchase services and IT. That's the growing area for cost increases when it comes to IT and outsourced services, even beyond medical surgical. With medical surgical, it's a steady price inflation, but when it comes to some products, it can be even more volatile when it comes to devices. And that's in that next line, device and implant costs are still highly variable and become even more so the more global disruptions that are out there. Vendor consolidation can lead to reduced competitiveness. So as we have more consolidation with our vendors, providers may lose leverage in some critical markets in order to negotiate. Supply disruptions, they are a normal state of business today. So providers will need to come up with methods in order to handle supply disruptions that they know are coming down the pipe. And we have some suggestions on how to do that later in the deck. Capital equipment and delayed replacement. So a lot of organizations have gone on delayed replacement strategies, but that brings its own issues. So you have to have plans in place on maintenance for those delayed strategies. Paul?
Great. So I'm going to continue on. There unfortunately are a lot of challenges within supply chain for 2026, as I'm sure many of you are aware of. So we're going to continue on with clinical variation, which was an area I think that we saw a lot of focus on prior to the pandemic. Things were really starting to pick up. That area has really taken a back seat, I think, during the pandemic and coming out of that pandemic. And part of that challenge is how do we reinstitutionalize the efforts around clinical variation and drive that continuous improvement within that particular space. Contract leakage and non-compliant purchasing. This has always been an issue within supply chain. Again, I think coming out of the pandemic, we haven't seen it across the nation really come back to that tight control and command and control around compliant purchasing. And so this is something to consider. Upstream manufacturing disruption. I'm actually going to combine upstream manufacturing disruption with logistics and distribution with quality. And I think the example we've provided in here is a good one. We talked about the resin market. A lot of people may or may not realize resin obviously is directly connected to gloves. And resin for gloves typically come out of Malaysia. So regardless of who your manufacturer is upstream, you would be impacted. So even if you did everything correctly, you had your primary source and your secondary source, you would still have been impacted or continue to be impacted. And that continues to be a particular space where we have logistics issues and we have quality regulatory shifts going on with regard to recycling of resins in the US market, not allowing that to happen or putting very strict guidelines around. That has an impact, obviously, on cost. It also has an impact on our ability to get materials, right place, right time. So you can see how all these things are intertwined. Cybersecurity, I think we're all aware of the challenges within that particular space. And a good example of that, I think, is Carolyn sent me the article a couple of weeks ago around Stryker. I think most of you are probably aware that they were facing a cybersecurity issue, and that obviously has an impact on our hospitals. So again, it comes back to what is your plan to address your supplier network when these types of issues actually face not just potentially your own organization, but your suppliers directly. And then the shifting care model. Carolyn alluded to this with all the regulation changes. We do plan to see a higher acuity within the acute setting. And so that is going to have an impact. But at the same time, obviously, we're trying to drive to a less acute setting for most of our patients. So with less acute settings comes more distribution of product and materials, which adds complexity to our overall supply chain and making sure that we have a command and control environment over that. So again, a lot of things to address. It's why we're here talking about it today. And then I'm going to move on to the price increases. And this is the predictions that we were able to ascertain within key areas of supply chain. The focus here is going to be on drugs and indirect spend or purchase services. These are continuations of high dollar increases or percentage increases. And the one thing to note here is that this is not really taking into consideration of tariffs or other aspects that are going to come into play that could have spikes within the year to come. I could tell you from one example of a colleague of ours who works for one of the large biomedical organizations that they weren't actually able to figure out what to charge for the products because of all the timing of materials coming in, the assembly of those materials, and the tariffs that were being faced at various times and places. And so they literally were paralyzed as far as their ability to ship product because they weren't sure what to charge. It's all to say that this is a very fluid type of environment. We will see significant increases, and we need to be aware of that and be able to address and mitigate wherever possible. With that, I'm going to hand it back to Carolyn.
All right, let's talk about what can we focus on now. Well, the first is let's figure out what it looks like today and what are our touch points. So we have our acute care hospital system there in the middle, but let's talk about our touch points just to make sure that we're all on the same page. So let's start at the very top and with the group purchasing organization. So most of our acute care medical centers are going to have relationships with our GPOs or with a primary GPO. That's going to be the touch point for a lot of the commodity contracts. And that is going to be a touch point where those transactions take place. Your contracts are held in that particular organization, and you conduct those contractual agreements back and forth with the GPO and the GPO with those suppliers. And that's a very important relationship. That's also where you can get a lot of information with regards to resiliency, and you can get some spend analytics from that particular GPO that you do business with, where you transact those transactions with. Anything that you spend through them, you can probably get your spend analytics. You also have distributors and logistics providers. So your medical surgical distributor, your lab distributor, et cetera. Again, those are also external transactions that are taking place. And those are also gatekeepers for allocations. Down below that, you're going to have GHX, Prodigo. Those are EDI transactions as well, where you're transacting information back and forth, and they can act for control towers for data transactions. You have your purchase services suppliers, clinical technology and risk management. So you are sending information to your CIS systems, your regulatory payers and government programs, your ERP, so where your MMIS system is. And you have information held within that system. That's also where you do your PO creation, your invoice matching, et cetera. And then your manufacturers and medical devices, where you may be doing your direct purchases with your manufacturers and suppliers. So that is our supply chain ecosystem. Paul, anything to add here?
No, I think that pretty well covers it. I think the next slide is how do we optimize this and address the key strategies for success? As Carolyn said, we outlined what the doom and gloom is. We've now outlined what we consider to be the complete ecosystem. Now let's get into what we think are the areas that you should be considering.
All right. So the first thing is really put together a supply disruption team. We know that disruption is here to stay. It's not going to go away. So putting a supply disruption team together to really track high exposure categories and have a plan in place and have a team in place that will actually handle those issues. Pre-approved contract language, pre-approved alternatives, tracking those alternatives, those will change over time. This is why it's not a one-time event. It should be a team that is in place ongoing. Really looking at unit price along with price protection and transparency. So you're not just looking at unit price, you're looking at all of the languages that are in the contract. You're looking at price escalators, tariff language. You're looking at, especially now, you're looking at fuel surcharges, all of those other contractual languages that can make the cost of the contract as much about all of the other price escalators as it does the unit price. Looking at supply assurances for critical categories. Do you have plans in place when those supplies go on back order? Are you having critical supply items, back orders, reserves in place? Do you have allocation and priority fulfillment plans in place? Are you having good management around VMI and consignment inventory? The other thing we'll talk about in a few minutes is around value analysis. So I would suggest, as does Coker, that you re-look at how value analysis is managed within your organization and having it be a lot more nimble than it probably has ever been in the past. So we're going to talk about how to do that. And then extend the supply chain. So as we talked about, it's moving beyond just the four walls of the acute care medical center. So really understanding how to do that and making sure that it extends to ambulatory surgery centers, hospital at home care, all of those other types of facilities. Paul?
Great. And I think it's a really important part there, Carolyn, that you mentioned around extending the supply chain, because again, the growth of the non-acute setting, a lot of times the products that we're contracting for at the acute don't necessarily align to the areas or the components that we're looking for and need at those non-acute settings. So oftentimes we find that the contracts, although they may be good, are not extendable in the way that we thought they were or usable the way we thought they were. I'm going to go back over to the total delivered cost at the bottom left there. And the basic premise here is that too often, traditionally, we just look at price. But to Carolyn's point, it's all the other aspects that are baked into what does that unit price look like. And so asking your suppliers to dig a little bit deeper and to provide a little bit more transparency about what are they facing from a freight waste substitution perspective? What are all of those aspects? What is the measure price plus freight inventory carrying costs that they are looking at and passing that on to you. There are certain things that you might be able to help with that. And if you understand the components to that, but also making sure that you are paying for what you're thinking you're paying for. With regard to hardwired compliance, making sure that your item master is structured and has a governance around it so it doesn't continue to grow, which we often see is the case. Also, making sure that there's no non-catalog ordering. Again, we see all the time. So having a set catalog, whether it be for indirect materials or direct materials, and making sure that those are the items that are only ordered and coming into your facility. And then having a controlled process for those non-standard items, whether they be from a research standpoint or unique in nature, having a standard process for that will help tremendously. With regard to the supply chain control tower, data is important and transparency is important. So continuously reviewing and having the dashboards at an executive level, and then allowing those executive level components to cascade down will be critical for your organization's ability to ensure that you're not starting to see large jumps in areas and then going back a quarter, 2 quarters, or 3 quarters, only to realize that you had huge jumps in your cost structure because of some of these areas that got out of control. Improved inventory accuracy in high cost areas. So those big dollar areas, your OR, your cath lab, ortho, spine, having very strict controls over the inventory, FIFO, expiry dates, reviews, audits, and making sure that the concept of hoarding is not a thing. It's a very common thing we see across the board, especially in these high dollar areas and high volume areas. And so that's something that we need to be cognizant of as we move forward. And the last area I'll cover is the centralized purchase services. So pretty much every organization we go into, purchase services is not centralized. And what we like to look at is the idea of a continuum, knowing that full well that because of where most organizations are today in healthcare, it's a long haul or a long maturity to get to a full centralized purchase services. What do we have today within a specific realm that we can come under one centralized area? And then over time, starting to move more and more underneath that so that we have the governance and methodology of how to do that. It's also ensuring that how we measure and how we track SLAs and supplier accountability and value-based contracting are all done in a very similar, standardized way as we roll forward. And so those can be applied and scale across our organization. So those are a myriad of different areas that we see as key to success in 2026. Carolyn?
All right. So let's talk about some of the must-haves that you need to have within supply chain. As far as skill sets, let's start at the bottom. Some of the skill sets that you need to have within supply chain is you need to have some nurses working within supply chain that can work with not only supply chain, but the service line leaders to help manage the cost and the outcomes. These nurses are really the ones that can be the translators between supply chain and the clinicians and the physicians to really help talk about what products are in use, what products should be in use, what are clinical equivalents, and can really help barter the conversation between all of the different constituents within the health system. It also is really helpful to have physicians working with the supply chain, being those key leaders that are helping, again, to be those facilitators with their fellow physicians in order to help you in cardiovascular, orthospine, GI, endo, all of those other areas that really you need to have a sponsor in order to drive those savings and those clinical outcomes that you need. You need to have strong data and financial analysts within supply chain. Data is king. Financials are king. And so it's really important for that control tower aspect that Paul was just talking about in order to have those financial analysts be able to run those analytics and be able to present them so that people can make good decisions. Having strong facilitators within supply chain that can have those conversations across different stakeholders, whether it be somebody in support services, whether it's somebody in biomed, whether it's somebody in surgical services, but somebody who can facilitate all of the different conversations in order to get requirements for requests for proposals or requirements for contracts and be able to negotiate those conversations. And then strong negotiators. We can guarantee you that the suppliers have been trained to negotiate. That's what they have been trained to do, is to sit across from the table and to negotiate the contract and the price. You yourselves within supply chain need to know your negotiating points and be able to sit at the table and negotiate back. So you need to have those same skill sets. Technology must-haves, and they're listed up there at the top. Service line analytics, really being able to match your suppliers, your procedures, clinicians, et cetera, and understand the revenue and costs by service line, et cetera. Rebate tracking, and there's a lot of organizations who gather the rebates but don't necessarily know, are they getting the right amount for their rebate against the right contracts? And are they getting the total amount that they should be getting? Compliance on their contracts. If they've written a compliance-driven contract, are they really complying against it so that they don't get penalized? A contract management system so they can drive their contract bids and they know 6 months ahead of time when their contracts are coming due. A good benchmarking system. And then, of course, spend analytics, knowing what you buy, what market share, et cetera. All right. So when thinking about your portfolio, and then your portfolio is really all of the contracts that you have within your system, we really recommend at Coker that you do a portfolio audit every 1 to 2 years to really understand who you're buying from, what type of contracts that you have, and are you getting the total value that you should be getting from your portfolio. That includes your GPO, that includes your direct contracts. And a lot of people have a hybrid of different types of contracts. And you should have a hybrid. From your GPO, are you on the right tiers? Even within the GPO, are you having a hybrid of local tiers, and then on the national portfolio, are you on the right tiers? When you're looking at going to contract, there's a lot of different variables that you should be thinking about even before going into a contract. When you're thinking about a strategic vendor, have you thought about exactly what it is that you want from that supplier? What are the services that you want from them? What are the service level agreements? What do you want that partnership to look like? What are the KPIs that you want to build into it? Those need to be thought about with your key stakeholders before you even enter into the RFP. You want to really crystallize what that agreement, what those SLAs, what are the requirements before you get too far down the road. Then when you get into the RFP, those requirements are almost writing themselves, and your key stakeholders can really help you in conducting that RFP and writing that RFP. When you think about working with your suppliers and building that new relationship, especially in purchase services, we really recommend that you worry less about the current scope of what you're getting from that supplier. Yes, it matters, but it also matters, what do you want in the future? What do you want that relationship to be? And what does that program, what could it look like in the future? And then really learn from different aspects of contracts that you've done with other suppliers and what are the good things that you can bring in to this new agreement. Paul, do you have anything to add?
No, I think that's spot on.
All right. So that really adds into this next topic, which is value-based sourcing and contracting. That really is going beyond unit price. It's really thinking about everything that you want to add into the contract. So it's going beyond and thinking about clinical outcomes, operational performance, supply assurance, financial impact, partnership, and lastly, innovation. What it really translates into in reality is building in things like outcomes guarantees, total cost per episode bundles, service level guarantees, risk sharing agreements, utilization management contracts. And then what we're seeing even more so in the market today are more innovative collaborations and co-development agreements. So really thinking again with those suppliers that you want to build a partnership with or more than just a transactional agreement, what does that value-based agreement going to look like? And really taking the time to think through how can you both win from this agreement? All right, Paul?
Great. So along the same lines, we wanted to share some trends that we're seeing in the GPO market and purchase alliance, but also align on what the state is. So with GPOs and where they're at right now, obviously they've consolidated down to three major GPOs that are the primaries in the market. And then you have a host of regionals out there who a lot of cases are underpinned by those national firms. Now, along those lines, a lot of these regionals are more specialized in order to provide either regional focus or a particular area, whether it be academic or something else. And so it's critical to understand who you're talking to and what they can offer you. Also, a lot of these organizations are offering technology and other aspects to the portfolio in order to provide more value to their customers. So that then brings up the next question is, how do we work with those organizations and make sure it's a win-win, like Carolyn said? And so on the next slide, what we want to make sure that we get across is GPO strategy, you should have one. So a lot of times we come into organizations and it's this response to, well, we want better pricing. They have scale. Let's use one of these guys to get the best pricing. Well, that's one piece of it, but ultimately, what does your organization need holistically? So if your organization needs best price at the pump, meaning we want to get the best price on the actual product, then we need to have that be carved out and be part of the overall strategy. Again, it's not about the market basket per se. It's more about what you're looking for and how you get that from the supplier itself. And so it's very similar to how Carolyn was saying before. And other areas with the GPO is making sure that it ties to your needs and then making sure it's a win-win for both organizations. And so a lot of this is going to come down to we need specific technology needs within a particular space, and they are bringing this to bear. They have the best pricing, and we need to bring that to bear. And we're focused on this much acute and this much non-acute. And let's see how they can deliver to those very specific needs and making sure that we break those out into components. There is contract needs and there's technology needs, and then there may be some other needs, but ensuring that you break those out so they're not as tied together and hard to look at apples to apples, because the three national organizations are quite different for the most part. And the regionals are much more different, I think, once you get down to that level. So making sure that you're looking at apples to apples is critical to delivering on the GPO strategy that you want to move forward with.
All right. So when you're thinking about contract vehicles that are really open to you, you really need to think through what is going to be the most advantageous for the category that you're working with. If you're looking at a GPO contract, there are still different types of contracts that are open to you. So keep that in mind. Always know that the national contract portfolio are typically table stakes. So there are different tiers within that GPO category, and you're going to qualify for whichever tier is available to you based on whatever qualifications, the volume and the spend that you have. If you have enough volume or spend, or say that you have worked with your supplier long enough that you have actually gotten better pricing than what is on the national portfolio, you have the ability to work with your GPO and develop a local tier with them. So make sure that you talk to your GPO about getting a local tier. If you actually have better pricing, then talk to them about getting a local tier. Or if you can negotiate a local tier that has better pricing or better terms than what your current GPO has, again, you have that ability on most GPOs to negotiate a better term. If you are going to join a committed program within a GPO, I have seen these be winners and I've seen them be losers for organizations. So you really have to look at it and understand whether or not the committed program that you're going to join in total is going to be a winner for you, because some of those contracts can drive losses in the long run. So you have to look again at that entire portfolio and see if it's going to be a winner or loser for you in totality. So you have to be able to commit to all of the terms of the contract. If not, you can probably drive the supplier, if you have enough commitment, to those same types of prices. It takes a little bit of work, but you can do it. The other thing is that there's a type of agreement called a membership agreement, and most GPOs will allow you to do this, and it will allow you to tie a direct agreement to a national agreement for the purpose of collection of admin fees. So don't forget that you have the ability to do that for the purposes of collection of admin fees. The only other thing I would say here is that if you have any influence, if you're sitting on any of the product committees on the GPO, please pay attention to those. Pay attention to all of the other language that is coming up on those agreements, the tariffs, the pricing, the escalation, the force majeure, everything else, because those are just as important right now. All right. So we said that we were going to talk about value analysis programs, and here we are. We're talking about value analysis programs. So here's what we've been talking about at Coker with a lot of our clients around the traditional, I would say, value analysis programs. What we're finding is that within the industry, there is a need to be a lot more nimble, especially within this environment with supplier disruptions, being able to move quickly on decisions, and frankly, around this idea of clinical protocol development and looking at cost. Everyone is looking at margin. Everyone is looking at margin and trying to figure out how to do things safely with safe clinical outcomes and making sure that we are being financially responsible at the same time. So the concept that we've come up with is a 3-tiered approach. The first one is down at the bottom. It's called the Just Do It's. And the Just Do It's are really your commodities. They're the products that don't have a large patient outcome footprint. They are truly your exam papers, your 4x4s, your can liners, the hot and cold packs, those items that really don't have a large patient outcome influence. Those are your Just Do It's, and you can create that list. Those are items that you should be able to make those decisions within a week. Have some clinicians that are on a team with supply chain. These are your nurse advisors. They can be elected to work with supply chain over the course of a year or so, and they are trusted to make those decisions for the organization. These are low impact items. You just do it. The next tier is the nursing council review. So these are the clinical preference items, maybe low level PPI, but definitely clinical preference items. Those do need review. They need research. They need business cases. These are things that you would typically think would go to value analysis. These are new and existing products. It's not just a rubber stamp for new products coming into the healthcare system. This is truly a review. This needs to be an operational type of work group. It's not a committee. It is a work group that is looking at products. It's almost like a formulary management. This group is truly looking at outcomes. It's looking at business cases. It's at financials. It's looking at the research on the product and making decisions like a product formulary. The top tier is the service line review. So these are your most impactful items, your robotics, your implants, those items that really are invasive and really can make a difference. These are the ones that you build clinical protocols around, decision matrices around. These are the ones where supply chain and a multifaceted group, physicians, clinicians, infection control, reimbursement, are all sitting in a room figuring out what are the best products that we need to use, what's the reimbursement, what's the way that we handle this, do we need a clinical protocol, a decision matrix. That's what that service line review, and there's multiples of these because they're aligned to orthopedics, cardiovascular, et cetera, are in place. Once those decisions are made, then supply chain knows how to contract for those supplies. They don't make the decision for those supplies ever, but they take the guidance from these committees, and then they know how to contract for those supplies. All right. So that is how we would approach value analysis. And then, Paul, I'll turn it over to you.
And now moving over to purchase services. And what we've seen here is that no matter where we go, purchase services tends to be somewhat unseen and unmanaged. And it's difficult to get your arms around it because typically any healthcare organization is going to have 100 to 300 different categories of these, in essence, are like small mini businesses operating within your own organization. So just to pick on one area, we have American Red Cross and blood there. They're both suppliers of blood. Very simple in the scheme of things. It's something we need, our patients need. It's critical to our procedures and our patients and our quality. But oddly, it's very complex if you know the ins and outs of that particular area. So on the surface, what we typically see is that there's a negotiated rate that's been put forth, let's say with American Red Cross. But that contract is not widely understood or executed by potentially your nursing. So now I'm buying off contract. And often we go in there and we'll see that the amount of off contract is significant because people are doing what they think is best, but may not actually know what is available to them. So then we see exorbitant spend because the contract that was negotiated is not being used. And therefore we have all this off contract spend that is much higher rate. Now, the other thing we'll see in the same premise is that you have players like in this particular area that specializes in areas where there's high profit margin. So they play in these high profit margin areas and they have very good rates. Well, it makes sense from a hospital perspective that maybe we should look at that and buy from them. When we do that, though, what we don't realize is that your bread and butter blood manufacturers like the American Red Cross lose all that margin that they were making and therefore have to charge more for some of the more basic commodity items that they were otherwise going to charge for you at a lower rate. And then you look at it and you realize, oh my gosh, we're actually paying more net altogether. And so that's the gist of all this. Another example would be, we had a client who was on a Microsoft shop and decided to go to Google, which is great. But at the end of the day, when they renegotiated that Google contract, it didn't contemplate certain aspects that needed to stay on Microsoft. So what did Microsoft do? They increased their rates for the areas that they still had within their contract, which ultimately increased exponentially the total spend that client was spending on technology. It comes back to, we need to get our arms around purchase services and ensure that there's a centralized command and control over it to make sure that everyone who's dealing in these particular areas is operating under the same premise, and that the communication, the negotiation, and all the aspects that underpin these negotiations are all taken into consideration. So with that, there's also, on our next slide, the idea of, well, it's not just outsourcing. There's also the idea of, well, do we do it within our own environment and hire our own people, or do we outsource it to a supplier? And so we've highlighted some areas at the bottom here that we typically see are always up for debate, whether we do it ourselves or do we outsource it. And so within each of these, we have to consider them unique. And benchmarking these areas, which we always normally do, is an opportunity to figure out where you drill in. But if you've seen one of these, you've seen one of them in a hospital because of where the hospital is located and what providers are available within that particular market for this particular service. What does the mix of patients look like? All those components lead to a very unique situation for a lot of these different areas. And so we highly recommend that there be tree effect of decisions as far as starting at the top and understanding, is this a significant area of cost for us? Is it worth going through the exercise? Number two, do we do it ourselves or would do it outsource? And understanding both cost levers, the benefit levers in totality, more control, less control, the cost components, the quality, everything. And also realizing that assistance in some of these areas is not a bad thing because ultimately, like Carolyn mentioned, a lot of the outsourced providers, this is what they do for a living. And they do this every day. And you may only look at this every couple of years. And that's difficult to work through because you're at a distinct disadvantage because they know exactly what is going on, what are all the levers, and can negotiate with that in mind. And so we just highlight this because it's often an area of significant opportunity with health systems, especially as we're needing to tighten our belt with all these other programs coming down. And as an example, this is just brings it to light, is what we typically see in this particular area. We're looking at biomedical services and imaging. The areas above the waterline are the areas that we typically see are considered. How much spend is in the department, the capital spend, and then the service level agreements. Well, that's great, and that's key to the overall negotiation. But then what about downtime, unnecessary SLAs, underutilized equipment? All the other things that go into the total cost, the total ownership, total operation of the relationship between you and them. And so on the right-hand side, what we've outlined is the value drivers that need to be considered within this particular area to ensure that we're not only addressing the needs of the organization in its optimal form, but also doing it at the highest level of quality and lowest cost. All
All
right.
right.
I'm going to hand it off to Carolyn to go through resiliency.
We've got two more concepts, and then I'm going to turn it over to Paul to wrap it up for us. But supply chain resiliency, we've been talking about it all along throughout the whole presentation. But what it's not is it's not lower inventory, and it's not never having shortages, because the fact is we are, and we will forevermore. And it's not just a supply chain problem. It's everybody's problem. So what is it? It's planning for clinical continuity, it's operational stability, and it's financial protection. So it's all of the things that we've been talking about all along. Really planning for that supply assurance for critical categories, having that plan in place. A rapid substitution of decision governance, price volatility controls, really looking at all of those clauses and all of those contract languages and having a plan in place for addressing those. And then having a supply chain control tower, having those tools in place, those newsletters from the GPOs, actionable dashboards and metrics, so you can make good decision making when those back orders and those substitutions come into play. The last thing we're going to talk about is artificial intelligence, because the fact is it is here and it is helpful. So we do need to have a plan in place for how we use artificial intelligence. It's coming for us fast and furious. What we would suggest is what we need now, though, is AI governance. So if you haven't already done this within your organization, really plan for that governance, ethics, policy, and training. I will tell you right now that all of your ERPs are planning for AI being embedded within their systems. Some of them already have it. So a lot of them within Workday, Oracle, Infor, GHX are putting AI within purchase order, touchless PO, contract validations, all of those things that you see there. But there's a lot more coming down the pike. So there's some really exciting things that you can see there on the other side of the screen, especially around enterprise data ecosystems and sharing forecasting data. But a lot of that's going to have to come with really looking at the ethics of sharing that data and how do we do that. So again, it does go back to what is going to be that governance and that policy and that training. And I'm not sure that all of that's going to be coming directly from regulatory bodies. It may have to come from us first.
Thank you for walking through that. I think one of the questions I saw in the chat was around some of the solutions out there within AI. We're agnostic to what the solutions are, but what we can, I think, mention is that what we're seeing is that the traditional technology infrastructure and applications are somewhat starting to take a back seat to AI agents that are specific to an organization. So basically, this 80/20 rule around building components of an agent, then taking it to a health system and customizing it to that organization so that the agent does a specific task. In creating that in rapid fire, we're seeing that some of the largest health systems in the country looking at that as a potential valid option for them versus your larger scale enterprise-wide systems. Now, these are solutions that are appending to your EMRs and your ERPs, not necessarily replacing those, but they're still acting and sitting on top of what would normally be a more structured, larger scale analytics platform that we normally see. So it's hard to really put your finger on and say, these are the ones out there. I think more so it's the creators of those specific agents and being able to do it in a structure that is underlined by this, the AI governance, the ethics, the policies, and the training, and ensuring that is all put in place is what's most critical that we're seeing. So with that, we're going to wrap it up. I have one more slide that basically brings it all together as far as supply chain advice for the future. Not locking in price protection. Suppliers are already factoring in price risk. All the things that we've gone through today, these are going to be critical for 2026 and moving forward. As Carolyn alluded to, 26, 27, 28 are going to be very interesting, dynamic, and challenging years ahead. And the farther we can get ahead of what is going on in the market and creating the processes and structures and governance in such a way that makes us certainly not immune to all these changes, but allows us to be much more flexible and nimble to adjust to what's going to be coming down the pipe is what's most critical that we see in the market. And so that's what I think we would want to leave you with, is that this is all working towards the idea of creating a differentiated supply chain organization and capability that will enable your organization to grow and do it in such a way that is sustainable and also be an enabler to your organization. And with that, I want to open it up to Q&A. There's a number of questions that came through. We only have a few minutes. I think one of the things we want to do is we'll go back and try to answer as many as possible today. And we'll also be sending out the materials of today's presentation as well. So one of the questions that came through, how do you prioritize which areas to tackle first when everything feels like a cost opportunity? I'm going to let Carolyn start and then I'll tack on if that's all right.
So one of the things that I usually do with my teams is that we take all of the data, because you're right, everything seems like let's do everything at once. I usually take a balanced portfolio approach, which means that I always want to have money coming in the door. So we do short, medium, and long-term initiatives so that we always have something coming in all of the time. So you can do easy things like doing tier optimization with your GPO, which should be short-term hits. And then you can also take longer-term hits like doing total joints, hips, spine is going to be a longer-term type of a project, or doing a purchase services. If you're doing an insourcing, outsourcing bid for biomed, is going to be a longer term type of a project. So that's going to be a longer term. So you can look at your spend analytics data do that first and find out what your opportunities are and do some benchmarking against it, and then really build out a portfolio of initiatives.
Yeah, I think that's pretty spot on. And I would just tack on the idea of in the short, medium, and long. A lot of times we also include the baseball analogy of at bat, on deck, and in the hole, so that you're continuously rolling through those initiatives and you're always prepped for the next item so that you build the muscles internally of how we're going to do this on an ongoing basis and that continuous improvement methodology. Okay, with one more minute, I'll get one more question. Where do you typically see the largest untapped opportunity today? I'll start, and then Carolyn, if you want to wrap it up. I would say, again, on purchase services, just because of the lack of centralization of it, the myriad of categories that are involved with it, and the fact that healthcare organizations are not best prepared to address all these varying areas that are essentially micro businesses.
The other area I would add to that is clinical variation and utilization. And that's an area, that's the top tier that we were talking about on that value analysis inverted pyramid, is really looking at those service lines and looking at clinical variation and standardization utilization.
Great. Well, Karen, thank you. Thank you everyone for joining today's webinar. We really appreciate your time, and we'll do our best to get back to folks after this. And we are Coker, and we appreciate it. Thank you.
Thank you, everyone.